Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we're going to look at the DIC. DIC is also known as the Disseminated Intravascular Coagulation. So we are looking at the causes, DIC causes. Disseminated intravascular coagulation. So this is an acute, subacute, and the chronic. It is an acute, it is subacute, and the chronic thrombohemorrhagic disorder. Hemorrhagic disorder, and it occurs as a secondary complication. And in a variety of diseases, it is characterized by the activation of the coagulation sequence, and this leads to the formation of the microthrombi. So it leads to the microthrombi throughout the microcirculation of the body, or microcirculation of the body, and as a consequence, the thrombotic diathesis is seen, and there is a consumption of the platelets, fibrin, and the coagulation factors. There is consumption of the coagulation factors, and secondarily the activation of the fibrinolytic mechanisms. Now let's look at the causes. So causes, first will be the obstetric. There's going to be obstetric complication. That includes the obstructive abruptio placenta. Then comes the retained dead fetus. Abruptio placenta, the retained dead fetus, the septic abortion, the amniotic fluid embolism, as well as the toxemia. Next, looking at the infections, there is the sepsis, meningococcemia. There is the histoplasmosis. There is aspergillosis. There is presence of malaria as well as the toxemia. So this is the infections: sepsis, meningococcemia, histoplasmosis, aspergillosis, malaria, and toxemia. Next, moving on to the neoplasms. The neoplasms, it includes the CA pancreas and the prostate and the lung as well. Pancreas, prostate, PP, that is the pancreas, the prostate as well as the lung. Then comes the acute promyelocytic leukemia. So causes, we saw the obstructive, abruptio placenta, retained dead fetus, the septic abortion. Then infection, there is sepsis, there is meningococcemia, histoplasmosis. Neoplasms, there was pancreas, the prostate and the lung cancers, carcinomas, and the acute promyelocytic leukemia. Now in terms of the massive tissue injury, so massive tissue injury, it includes the traumatic injury, the burns, as well as the extensive surgery. So there is traumatic injury, there will be burns as well as the extensive surgery. Now looking at some miscellaneous diseases, it includes the acute intravascular hemolysis, as well as the snakebite, shock, stroke, and the vasculitis, and aortic aneurysms and the liver disease. To learn and grow daily like this, please do subscribe.